During wheelchair skills training, you should be aware of potential injuries and how to avoid them. One type of injury we have already discussed is tips and falls, including some strategies to avoid them. Some individuals find that propelling a wheelchair can be hard on their hands, particularly if they have fragile skin. Pushing and rubbing your hands on the push rim can create a variety of problems, including discomfort, bruising, abrasion, and friction burns. You should also be careful not to catch your fingers in the spokes or wheel locks on your wheelchair. One strategy is to wear fingerless gloves, which are typically available from your wheelchair vendor or from many sporting goods or departments. Weightlifting or cycling gloves are very similar and can be used effectively for wheelchair propulsion. A third type of problem sometimes seen is overuse or repetitive strain injury. Because you are using your arms constantly to propel the wheelchair, you may notice pain in your shoulder, elbow, or wrist. Several strategies can help minimize the effect of this repeated use injury. First, try to take rest breaks so you are not propelling your wheelchair for very long periods of time. Second, try to use smooth, long pushes whenever you can and allow your wheelchair to coast before you push again. Finally, using gloves can help to soften the impact between your hand and the push rim, which can help to reduce injury. A fourth issue to be aware of is overexertion. On the one hand, using a wheelchair can be a source of fitness and exercise. However, you should also be careful that you are not pushing yourself to the point of fatigue. The Borg Scale rates your exertion, or your perception of how hard you are working, on a scale from 6 to 20, shown here. For example, 9 is very light, 13 is somewhat hard, and 15 is hard or heavy exertion. As you are training, think about what you would rate your level of exertion or work on this scale. Your rating should always be 14 or less. If it is 15 or more, you should slow down or stop and take a break.